Contraindications are allergies. The allergy to cold is called cold urticaria, and what they have a reaction with hives and itching anywhere the cold has come in contact with. Raynaud's phenomenon is a reflex vasospasm of the distal arteries, usually in the toes and the fingers, and it's a restriction in blood flow that results in blue, gray, or purplish discoloration of skin with burning, tingling, or numbness. And again, you're most likely going to see it in the toes and the fingers. Peripheral nerve injury, hypertension, decreased circulation, and arterial insufficiency. Precautions would be post-surgically if they have an open wound. Slow healing wounds, decreased sensation in area, poor local circulation, and superficial nerves. Examples of these are usually your ulnar nerve and perineal nerve. Quick facts. Hunning's response is a reflex increase in vasodilation of an area after being subjected to a prolonged period of cold. It's a defense mechanism, and the tissue temperature increases after about 30 minutes of treatment. The main reason for that is it's trying to prevent you from having frostbite. So importance for us, you need some breaks between cold therapy applications. So a lot of times you'll hear keep it on for 20 to 30 minutes, but then take an hour break or a 2-hour break. Cold application is maximum effective when combined with compression, elevation, and protection of the injured tissue. Superficial heat primarily causes increase in skin temperature and superficial subcutaneous temperature. It's usually going to penetrate about 2 centimeters, and the deep heating depth of penetration is around 3 to 5 centimeters, but that's mainly going to be your ultrasound and diathermy. Superficial heat has little to no effect on the temperature, metabolism, or blood flow below the skin except in areas of little fat, so that's going to be hands and toes. It is used primarily to decrease pain and muscle spasm. Superficial heat examples are moist heat bath, and the temperature of a hydrocollator is going to be around 170 degrees Fahrenheit. Always need to provide adequate layers between the skin to decrease the chances of burns. Warm whirlpool. This allows you to heat around an entire joint. The motion of the water creates a massaging effect which may add to analgesia and antispasmodic effect, and the gate control theory, which you'll learn about in the E-STEM lecture. This allows for active and passive motion while heating, and it should never exceed 115 degrees. Treatment in a whirlpool can stress the body's ability to dissipate heat, especially if they're all the way in. So you have to be careful because treatment can result in hyperthermia and heat illness. So you never want to put an athlete that is having some issues with heat illness into a hot whirlpool. Paraffin bath is 7 parts paraffin wax and 1 part mineral oil. It's heated to 125 to 127 degrees Fahrenheit. Most commonly used with hands and wrists. And the way to apply it is you dip the body part in, let it dry, and repeat 4 to 5 times. You place it in a plastic bag and wrap in a towel for 20 to 30 minutes. You do not use it on open wounds. Heat lamps, again, we haven't used these very much because there's a chance of burns. They have been replaced by moist heat baths due to the cost and convenience, and these are based mainly on their effectiveness in the inverse square law. Fluidotherapy is a dry whirlpool. It contains ground cellulose material that is heated to 120 to 125 degrees, and it's blown around a chamber with air. It heats through convection and massage. It allows for passive range of motion and active range of motion, and you can treat athletes with open wounds, and it is not in a gravity-dependent position. Physiological responses to heat. Increased skin temperature. It increases circulation and inflammation to the area. It decreases viscosity or thickness of fluid and inflammation. Increases superficial metabolic activity, increases oxygen uptake, nutrients, and waste removal of the superficial structures. It also can increase tissue elasticity, so that's why it's a good time to stretch after or during heating to get the maximum effects. The nervous system. It increases your pain threshold, increases nerve conduction velocity, decreases ability to produce muscle tension and analgesia based on the beta endorphin response, which is the picture to your right. It can be used on the pain spasm cycle. It decreases sensitivity of muscle spindles, which decreases spasm through a spinal reflex. Heat alone will not alter viscoelastic properties of tissue. So what this is saying is heat alone is not going to increase the thickness of that fluid or the elasticity of the tissue. But if you do stretching and movement after, then that will increase your elasticity. Indications are post-acute conditions, chronic conditions, no inflammation, muscle spasm, trigger points, infection, as long as you always cover it properly, joint restrictions, contractures, and for pre-stretching and pre-practice. Contraindications: poor or reduced sensation, vascular insufficiency or disease, sensory deficits, acute injury, inflammation, malignancies, eyes, genitalia, abdomen of pregnant female, skin lesion, or open wounds. Precautions would be burns or coronary heart disease. Contrast therapy, alternating heat and cold. Most common usage is transition from cold whirlpool to warm whirlpool. Other options would be ice bag and moist heat pack. This is shown to decrease edema in subacute foot and ankle injuries with active range of motion. Physiological response creates superficial pumping action of the blood vessels. So cold is going to vasoconstrict and heat is going to vasodilate. How does it work if heat has a minimum effect on deep blood flow? It can be effective where there is minimal tissue and more joint surface area is exposed. So foot and ankle injuries, it's going to work the best. Use along with range of motion to increase the pumping effect caused by muscular contraction. This is commonly used to treat subacute foot and ankle injuries. Any questions?